The rear Azalea is a tilt-in-space wheelchair used for people who require a high level of postural support. It will have been adjusted by your wheelchair therapist to meet the individual needs of the service user at handover. If you are using a rear Azalea that has not been adjusted specifically for the individual sitting in it, it is recommended to contact your wheelchair service. This video will explain how to position the individual correctly, demonstrate the features of the wheelchair, and points to look out for. It is important to ensure the individual is positioned correctly to protect their posture and maximise their ability to engage with their surroundings. Poor positioning can lead to deterioration of posture, risk of pressure ulcer development, and reduced participation. A rear Azalea wheelchair has two positioning functions: tilt in space and recline. Tilt in space is where the seat angle remains at 90 degrees at the hips and the seat and backrest move together. Recline is where the backrest moves independently of the seat. It is anatomically better to maintain 90 degrees at the hips, as this ensures an even distribution of pressure and is less likely to cause shearing. It also improves function and reduces the risk of postural deformities from developing. Please be aware that when the green lever is released so that the seat is in the most upright position, the seat is actually in negative tilt, which would encourage sliding. This is the rear view of the wheelchair. There are a few levers on the push handles. These are the brakes used to keep control when pushing the wheelchair. The green lever on the right tilts the chair whilst maintaining a good seated position, and the yellow lever on the left reclines the backrest. Occasionally, at the point of handover, the recline may have been locked off by fitting a red tab. This will prevent the yellow recline lever from being accidentally used. The headrest and lateral supports need to be removed prior to hoisting the individual into the wheelchair. To remove the headrest, loosen the thumb screw as shown and lift out. To remove the laterals, loosen the thumb screws and slide out as shown. When removing the laterals, you may need to gently press the lateral towards the occupant to get it to release. For safety, ensure the wheel brakes are engaged so that the wheelchair doesn't move during hoisting. Tilt the wheelchair as shown by hooking your foot under the bar and using the green lever. This will make it much easier to get the person's bottom to the back of the seat. Remove the leg rests by pressing the grey button underneath. Swing them out to the side and lift off. You are now ready to hoist. To achieve the optimum sitting position, it is recommended to use the shortest loop on the shoulder strap of the hoist sling and the longest on the legs. This ensures that the angle in the sling encourages a neutral pelvic position. Please check with your sling provider if you are unsure which loops to use. It is also important to check whether the sling is suitable to be left in the seat or whether it needs to be removed. As you can see from these pictures, positioning in the sling can be fundamental to achieving a good position in the wheelchair. The picture on the right shows the position achieved when the sling is used with the short top loops and longest on the legs. The pelvis is in neutral with hips at 90 degrees to the trunk. The picture on the left shows the position when both the short loops have been used, meaning that the hip angle is more open and the pelvis is tilted backwards. This could encourage the individual to slide down in the seat, and it will also be difficult to ensure that their bottom is right at the back of the seat. By identifying the correct loops on the hoist sling, guide the person's bottom by sliding it down the backrest to ensure that it is as far back as possible, and guide from the front to ensure that the pelvis is neutral and not tilted or rotated to one side. If the first attempt is not successful, try rehoisting to reposition. Ensure that the lap belt is secured and fits with a 2-finger gap between the belt and the pelvis. Once they are seated in the wheelchair, refit the leg rests by connecting them into the mount and gently guiding the leg over the calf pad. As you swing them to the front, they will click into place. You can see whether the individual's bottom is right at the back of the seat by either checking the gap underneath the backrest and seat cushion or observing the gap behind the knee and the front of the seat cushion. There should be approximately 2 to 3 fingers between the back of the knee and the front of the seat. If there is significantly more than this, it may be that the person is not right back in the seat. The headrest would have been adjusted at the handover appointment. It is important to make sure that the headrest is removed before hoisting and not pulled, as it will be difficult to get it back into the right position. The headrest should be touching the bottom of the head without pushing it forward. Lateral supports may have been fitted to one or both sides during your handover appointment. They are designed to be placed between the individual's trunk and the inside of their arm. They will need to be fitted once the individual is in the wheelchair. It is important that they are fitted up to the stopper on the rear of the chair to provide appropriate support. It is important to ensure that there is a 2 to 3 finger gap between the top of the lateral and the armpit. This picture demonstrates visual pointers to ensure that the person is correctly positioned in the wheelchair. Your wheelchair therapist may have taken pictures at the point of handover. Please refer back to those pictures. The shoulders are in line with the backrest. The arms are supported by the armrests without raising the shoulders. The feet are comfortably positioned on the foot plates with as much contact as possible on the sole of the foot. It is recommended that footwear is worn. At the back of the wheelchair there are a pair of anti-tippers. These are designed to prevent the wheelchair tipping over backwards when in full tilt. They can be adjusted using the push pin as shown. It is recommended to avoid hanging bags off the back of the wheelchair. An individual's position in their wheelchair is so important in preventing postural deformities, reducing the risk of pressure ulcers, and primarily to ensure comfort and participation. You can see here that the bottom is correctly right back in the seat, with the thigh fully supported by the seat cushion, ensuring an even distribution of pressure throughout. This image demonstrates how to recognise when the person has slid forwards in the seat. A gap can be seen behind the bottom and it looks as though the seat depth is too short. Alternating the tilt function of the wheelchair can promote more effective pressure relief. Tilting further back can help relax the body and reduce the risk of the head or the trunk coming forwards. Being more upright can assist functions like eating and engagement in activity. Please be aware that when being used as an occupant seat in transport, it is recommended that the wheelchair is as upright as the individual can safely tolerate. If you or your carers feel that your needs are not being met within the wheelchair, please contact the wheelchair service for a review.